Bacteria that come into contact with unbroken skin will not be able to break through the dermal and epidermal cells. Bacteria may not be able to survive secreted salts and lipids of the skin or fall off with soft skin cells. Bacterial cells that are successful in remaining may receive the opportunity to enter the body if injury occurs and the skin barrier is compromised. Immediately, pro-inflammatory chemicals will be released and symptoms of inflammation such as swelling, heat, and leakage of vessels will occur. The purpose of this is to prevent spread of pathogens from injury site. Resident macrophages work at consuming foreign material while additional phages and neutrophils are recruited to assist in pathogen containment. Blood and other fluids that contain adhesion molecules and antibodies are also directed to the site. Clotting factors work at coagulating the blood so that the wound can seal, preventing further infection. These are all processes of innate immunity, which can be summarized as the containment and destruction process. The next step is to initiate adaptive immunity. The initial infection may have been successfully contained or spread and induced further inflammation and possibly requiring treatment. Either way, dendrite cells would have consumed, broken up, presented a piece, and traveled to the primary lymph node. Here, immature B and T cells would have been stimulated to travel to the secondary lymph and mature. T cells will differentiate into CD8 and CD4 cells. CD8 cells will leave the lymph and induce apoptosis in any cell that they recognize as distressed by a pathogen invasion. CD4 cells will help activate naive B cells. The T cells will continue on to be a memory helper cell while the B cell differentiates. B cells will generate plasma cells that are armed with specifically programmed antibodies and ready to attack pathogens. Secreted antibodies recognize their pathogenic targets, attach, sometimes to immobilize and prevent host acquisition, but ultimately tag for attack and destruction by other lymphocytes. Other B cells will continue on as memory B cells and travel the body and attack the targeted pathogen immediately if it is introduced again.